It's timely at this point in time for us to do several things. First of all, to continue to remind members of the public to adhere to safe distancing, the prevailing safe management measures wherever they go, even though the current community restrictions are in place, and to be meticulous about wearing their masks, to be very disciplined, and only to remove it if they are consuming food and drink. But even then, out of doors, given the current restrictions, to continually wear their mask. That's important. And since we are continuing to emphasize this, it actually is timely for us also to relook at the mask advisories we give. And we want to affirm and emphasize that it is important to use good quality masks. Good quality masks worn well and properly provide an excellent form of protection for all of us against how the virus spreads, irrespective of whether it spreads by droplet or some form of aerosolized transmission. Wearing the good mask, wearing it properly makes sense and is the right thing to do. So we're sharpening the guidance and advisories we're giving to make this clearer. We encourage members of the public to use masks that have adequate and decent filtration efficiency. These would normally be printed on the side of the packaging or box that the masks have to give you assurance that the masks that you purchase or procure have that adequate and reasonable quality. The masks that have been distributed in public and community programs, most, if not all of them, do fit that standard. But it's important that if you use disposable masks, be aware that the masks have a certain lifespan, and after you've used them and washed them beyond the recommended number, it's advisable then to change and replace those masks. But you can use either the reusable mask or the single-use disposable mask like a surgical mask. And they do have adequate filtration effectiveness that is desirable. We continue to discourage the use of masks that have exhalation vents. These are masks that may make it more comfortable to use. They may be more appropriate at times when there's haze and using the mask for those purposes, but they would not be adequate from the public health and infection control perspective, preventing infection spread if an infected person wears such a mask, and there still continues to be a risk of droplet and aerosol transmission if a person sneezes or coughs from within those masks. So we want you to wear a good quality mask. A good quality mask worn badly is not good. It doesn't give you or the community any protection. So wear that mask properly and use a proper mask.